Hello, hello, hello. Happy Tuesday. Happy Tuesday, June 22nd, 2022. Almost said 1922. 2022. It is summer in America. Happy summer. Happy first day of summer. One of my favorite seasons. Spring, late spring, summer, and early fall. So happy summer. Happy Tuesday. Hello to all. My name is Abby Tyler. I am a family nurse practitioner. I am your host and content creator and community health volunteer. Welcome to all our new followers and those of you who have joined the ATHL family. Thanks for accepting my invitation to join and to come along with this journey of health and wellness. So, as you can see, I am going to go in here and just change my title there for a second. Okay, so the title of the show today is about as a regular Tuesday show for those of you who are new here. I come on Tuesdays to talk about regular health things, and then on Friday I do some just Friday with chat with Abby. I also do some health information on there, but this one is mostly the medical show. So, as you can see from the heading, it says low blood pressure. When should you be concerned? I thought about doing this topic. I was going to do another topic, but I thought about this today because the health fair I was at on Saturday. By the way, hi to all of you who I met at the health fair and who will be joining in later. Um, and a lot of people were saying they had low blood pressure because we talk so much about high blood pressure and we try to make sure we tell you to keep your blood pressure down so you can be safe to prevent any heart attack or a stroke. So, but some people have low blood pressure, but some people run low normal. But and what's the questions I got on Tuesday? On Saturday it was, so when should I be concerned? When should I be concerned? So I decided to do a topic on this. So for those of you who will be joining me tonight, I say thank you. For those of you who will be joining me later, I say thank you also. And these shows are just my duty shows or conversational pieces. So you can take this so your doctor, and if you have any questions or concerns, you can bring it up with them. It's not, I'm not going to make this long, and I'm not going to can teach everything on here, of course. So, as a disclaimer, my disclaimer, whatever I say here, shouldn't take the place of you going to see your own doctor and your own doctor or provider. So, I'm going to be reading from my phone. So, let me put my glasses on and be reading my notes, okay? So, once again, thank you and happy summer. I'm so happy. I was like summer. Anyways, so I'm going to go in here and let me start. So, okay. So low blood pressure, blood pressure is the means the force of blood moving through your arteries. There's the blood vessels and all that. Usually when low blood pressure is like 90 over 60. Healthy blood pressure is 120 over 80, 120 over 70 to 80s. Low blood pressure is 90 over 60. Now, some people run low normal, like I said, and that's okay for them. But usually, if your blood pressure runs that low and you start becoming symptomatic, that's when you should be concerned. And I'll go on to that. Okay, so the two type of reason that your blood pressure is low. Some people have orthostatic blood pressure, hypotension. Low blood pressure, the medical term is called hypotension. Hyper is anything that's hyper, that's higher. Hypo is low. So hypotension, or low blood pressure, one of the causes is orthostatic hypotension. Is when you usually when we talk about that is when you stand up and you stand up too fast and you feel like you're gonna pass out or you feel like you're gonna lose your balance and you feel a little lightheaded. That's what happened because you're standing up and your brain and your heart and your brain's not getting the message quickly enough that you're supposed to be standing up and get your blood pressure regulated. And the other reason, and because of that, that can cause fainting, dizziness, nausea, and they're triggered by different situations. And the other one is neurally mediated hypotension. That's the one that comes from diseases that destroys that affect your nervous system. Okay, so some of the symptoms of like I said, when should you be concerned? So some of the symptoms I was telling my new friends that I met on Saturday, and also I tell my patients like the symptoms to look out to when your blood pressure runs low. If you usually run low for your blood pressure running low, so symptoms would be dizziness, like I said, lightheadedness, tired, blurred vision, confusion, fainting or almost fainting or feeling fainting, weakness, and all. The severe symptoms are weak and rapid pulse, if you pale or bluish, if you're black, you're kind of like pale skin, kind of dusky color, flushed and everything, sweating, feeling of warmth and flush, and then later on cold and sweaty. And this will happen when you go into shock. So that's when your blood pressure is like really, really dangerously low. So you don't want to get to that point. And everybody I know, they don't take their blood pressure every day at home. You just when you're home, you don't want to be taking your blood pressure every day. But as sometimes that we tell our patients, take your blood pressure every day and take it for like a couple of weeks, and then you can text it in, or you can come back to the office and we can check in to see. Because sometimes when people go to the doctor's office, their blood pressure is like, really high. It's called white coat hypertension, where they're nervous and everything. So the blood pressure is usually not considered at rest. So when you're home, when you're relaxed and everything, you have your breakfast or you wake up in the morning, you're more relaxed, you take your blood pressure, and that's what it is. But when your blood pressure, when you're taking blood pressure medications and all that, your blood pressure starts getting low or for some other reasons, that's when we start getting concerned. Okay. Alrighty. So I'm gonna go over here. So some of the most major causes of I'm not gonna go dwell too much into the shock part, because by the time you get to the point where you're pale and bluish and rapid heart rate and all, you want to make sure by then you've called 911 and they're to the hospital. And like I said before, and have said in other videos before, there are many diseases that have almost similar symptoms. So most of the time is we want to take care of the most dangerous one, the one that's going to cause you the most life-changing event. So if you're having these symptoms where you're like bluish, feel like you're going to faint and all, and your blood pressure is low, and you're thinking, okay, maybe it's just my blood pressure, maybe I should just sit down. You could be having a stroke also, or your blood sugar could be low. So we also always want to make sure that we're taking care of the most serious one, and then the rest of the one you can follow up with that when you follow up with your family doctor. Okay, so this will be the time to go to the emergency room. All right, because like I said before, orthostatic hypertension is like when you stand up and you feel like you're gonna faint. So then you sit down and you kind of relax a little bit. So some of the causes for hypotension, which is also called low blood pressure, pregnancy, but pregnancy can also cause high blood pressure. So that's why you want to make sure that you follow up with your OBGYN's visit. I think it's like every month, and then and as you get closer, it's like every 2 weeks. Dehydration, when you're not drinking so well, the blood level, your blood down, the fluid volume in your body becomes low. And of course, just imagine if you have a water balloon and you put a lot of water in it and it stays pop, or you put air in it, you can see the pressure and it stays like that. Well, when the water is not there, the balloon collapses. So that's the same thing. If you have your blood, if you're supposed to have a certain amount of volume of blood and everything in your body, or the fluid in your body, and it becomes low, of course, your body's going to collapse. Not necessarily collapse, but you're going to start having feeling the symptoms, like I told you, your faintiness, blurriness, and all that. Also, menstruation. If you are a heavy bleeder, that's why some people have that's when they have to go see their GYN, and they may have to put them on some kind of medication that regulates their heavy period too. Because some people, when they have heavy menses, they suffer from headaches, they suffer from dizziness and all, and you don't want to be having that and that can also lead to anemia, which anemia is also one of the reasons for hypotension. All right. Okay. Diarrhea, if you having loose stools continuously, for especially for over a couple of days, you're losing a lot of fluid, you're losing all your electrolytes and all through that can also cause hypertension. Diuretics, from blood pressure medicine, that it's like took the fluid out of your body. For people who have like congestive heart failure, some other reasons why you're taking on diuretics, mostly for high blood pressure, that can also cause. Now you can also say, but why would they be giving me medication that's going to cause high blood pressure? That is a low blood pressure, sorry. So that is the reason why when we put you on the medication, we tell you to come back and get checked. Or some patients also, we prescribe them, we give them the blood pressure cuff, and say make sure you check your blood pressure every time. If you're having these symptoms, making sure you check it and report back to the doctor. Okay, report back to the doctor's office. Don't just let it go. Report back and say, okay, I've been taking this medication for a little while now, and every time when I take it, I don't feel like myself, or something is going on that I feel like I'm going to faint, and I haven't been having these symptoms. I didn't have these symptoms prior to taking this medicine. So can you please just check to make sure everything is going well? So you please, please, please bring that to your doctor's attention. Don't just let it go. Again, like I said, there are other major diseases that also the symptoms also mimic that, but hypertension kind of falls within those diseases also. So you want to make sure you bring that to your doctor's attention. Don't just let it go, because if you fall, if your blood pressure is so low, and if you fall, somewhere where nobody's paying attention to you, you could just lay there and suffer devastating consequences. You could hit your head. And what if you're driving or you're doing something with your children? So you want to also keep an eye on that. Your health is your business, everything about you. So if you're feeling differently, make sure you bring it to the doctor's attention and be and watch it. Say, okay, this was happening when I took this medication. How long after that? And if I don't take the medication, but you don't want to stop taking your medication until you speak to your doctor, okay? If it's an emergency, then you go to the emergency room. Don't just say, well, I didn't want to do this and I didn't want to do that. I understand, but make sure you bring that to your doctor's attention. All right. Okay. All right. Thyroid diseases. Again, like I told you guys, the thyroid functioning is like the motherboard. I did 2 shows on hypothyroidism, low thyroid, and hyperthyroidism. So go back and watch that and get some information about that. But the thyroid gland is the one that regulates just about everything in your body. So if there's anything with it off and on and it's not regulated, that can also lead to hypotension, low blood sugar, and diabetes. If your blood sugar runs really low, and sometimes your blood sugar will be completely low to where somebody walk into the room and you're completely passed out. Usually, I tell my patients to, I think the American Diabetes Association, you have like a little bracelet you can put on there, say, I have diabetes. So because sometimes if you sit in somewhere, especially if you're younger and you're sitting somewhere, people will probably just think, oh, well, he's probably drunk or she's probably drunk or she's probably on drugs and not knowing your blood sugar is low. So it's always good to have that, especially for older people too. When you're somewhere and you check that, because they get confused even more, they get confused quicker than anybody else. So always have that being. Some people have the bracelet. Some people they have different ones where I have high blood pressure, I have diabetes, I have seizures. So you have all these different things. Speak to your doctor about that to see how you can go about getting a bracelet to protect yourself. Diseases with the nervous system, Parkinson's, dementia, and other atrophy, all those different things, Guillain-Barré syndrome and neuropathy, all those different things. Like I said, the two different major things that cause low blood pressure. That can also happen. So the major things would be your menstruation, diuretics, low blood sugar, thyroid disease, and other neurological diseases that can cause your blood pressure to be low. And sometimes also when you're hungry too, you haven't eaten. I mean, if you're not eating and you're not drinking that much, that also leads to the dehydration. Like I said, nausea, vomiting, and diarrhea, that can also lead to low blood pressure. So if that is going on, they say you vomiting for a day or so, I would say no more than a day, call your doctor's office and get that check. Okay. Because sometimes just be something that you ate that is like in your stomach and it's upsetting your stomach and it needs to come out. Sometimes you need to vomit everything out until your body feels a little better. Bring that up, but you shouldn't go vomiting more than one day through one whole day without notifying your doctor. Now, if you have other diseases, like if you have like renal disease, your kidney disease, you're on dialysis, you have other issues, major issues, and you're vomiting 2 or 3 times that one day, bring it to the doctor's attention. Okay, don't wait for 24 hours, because especially if you have kidney disease, that can really throw everything off balance, and you can't afford that. All right. So we'll go in there. So again, so when you should see that, like I said, when you should get concerned, when you start having those symptoms, dizziness, feeling of being faint, and all, bring it to your doctor's attention. And most of these diseases also, it could be like, okay, your blood pressure could be low, but at the same time, you could also have inner ear imbalances too. So the dizziness, again, like I said, things mimic each other. So you can be having dizziness from the inner ear imbalance, you can have vertigo, and also you speak to your doctor and they can go about doing that and call your doctor. So when should you go see your provider? If you have symptoms of low blood pressure, you should see a doctor. You can concern your healthcare provider. Low blood pressure can be maintained because they have medications out there that we can give you that can bring your blood pressure up. It's not going to make it higher than what it's supposed to be, but it also will tell you that you have to manage your blood pressure and see how it is on this medication. So we're not going to the opposite end. Okay, so there are many medications out there that can be given to you. One I notice I don't usually talk about medications because there are a lot of personal things and like allergies and other histories. That's why I say speak directly to your doctor. The reason why I do these shows is for you to, is a conversational piece, so you can take it to the doctor and then say, you know what, I was watching something on Facebook and I heard this and I just wanted to bring it to your attention. Okay. Alrighty. So depending on the cause of the blood pressure, your doctor is going to proceed on where to go from there. the ENT, like I said, if you have any inner ear balance, some people who have like major, a lot of ear infection as they're growing up and other things going on, hard of hearing, they can go in there and look in there. Well, when you say ENT, ear, nose, and throat doctor, and they can go in there and check to see if there's anything that's going on, because that can also cause dizziness too. So they want to make sure you want to rule that out. Okay, and it's not, and like I said, also if there's dizziness is going on, blurry vision, go to the emergency room, because you don't want to say, oh, well, maybe it's just this. Again, we want to rule out the most important one, the most devastating one, diagnoses, before we go on, before we move on from there. Okay, they may have you go see a cardiologist also, because may have to have a cardiology workup, because what is causing your blood pressure, especially if you're in a primary care and we have changed your medication a couple of times around and it's still causing your dizziness, then of course we're going to refer you to cardiology to make sure to do other testing to see what's going on there. All right, we may send you to also to neurology if we think there is something that's more, that is not ENT, that's not cardiology. And sometimes you may have to see combination of all these doctors to finally get to a diagnosis. Some people, the diagnosis is seen right away. Okay, we take this blood pressure medication away, or we lower the dosage or change the medication, and the symptoms are better, or the symptoms are much less, or completely dissipates. And sometimes you need to see other specialists as well. Okay. And staying hydrated. Okay, some of the things you can do: staying hydrated, making sure you're drinking enough water, a lot, and water, not alcohol and not sugary drinks, especially if you have other diseases and all. So making sure you're drinking enough water. Again, if you have CHF, if you have kidney diseases, and you have other issues that you're not supposed to drink too much water, check with your doc first before doing that. But you want to stay hydrated, especially this time of the year where it's like very humid. If you're outside, drink a lot of water. Don't just say, I'm going to take some water ice or some ice cream or and whatever it is, and I'm gonna, no, that's not going to keep you hydrated. So you want to drink a lot of water. I try to drink at least 8 ounce bottles a day. So, and especially when you're going outside and you're playing outside, make sure for the little kids too that you stay hydrated. For the elderly people, that just stay hydrated, because they get dehydrated much quicker than we do, than people who are younger. Because I'm up there to myself. Not elderly yet, but I'm up there to myself. So, okay, so staying hydrated, talking to your doctor about medication changes. Like I said, it may have to change your medication around to see. If you have heavy periods and all, talk to your GYN. They may have to regulate you by putting you on some medications, or there are other options that they can do to help you with the bleeding, because you don't want to faint when when you have menstrual issues. If you become anemic, you don't want to faint. That's the same thing with low blood pressure. That leads to low blood pressure, or a result of low blood pressure as well. Also, position changes for those of you who have orthostatic, for those who have the orthostatic hypotension. When you stand up, we tell patients, when you stand up, make sure you're standing close to something that you can hold on to. Okay, so if you're standing next to the bed, lean against the bed. If you're standing up next to the chair, lean against the chair. Don't just jump right up. Okay, stand up, stand in place, like it's a standing place for about maybe 5 or 10 seconds. Get your bearings, making sure you're holding them to something, or maybe make sure whatever's behind you is not movable, that is not going to slide back. So if you're standing in front of a sliding chair or wheelchair, if you are in a wheelchair, make sure that it's locked. If you're standing in front of a bed or a chair, make sure that it's in place and it's stable, that you're not going to fall back. Stand there, get your bearings, and then move. Now, sometimes your doctor may tell you, is it possible for you to take your blood pressure at home when you're sitting down? Because we want to see the difference between when you're sitting down and when you're standing up. Okay, usually this is for patients who can do all that, or they have like a visiting nurse or visiting aide at the house that can help them with that. So we'll tell you, stand, take your blood pressure. Take your blood pressure laying down, and take your blood pressure standing. Because we had a neurologist that said between sitting down and laying down, it's not, it's no big difference. So it's like, do it from your laying down position and then standing up. But some people still say do it laying down, sitting down, and then standing up. So when you do stand up, you want to make sure you're standing up, get your bearings first, and then take your blood pressure. Take it, so from laying, sitting, standing, and they might tell you do that over like maybe like a week or so, and then bring and log it, making sure you're doing it at the same time every day, and then bring it to the doctor's office, and then they can see which medication need to change. So they'll tell you whether they need to send you over to see the cardiologist, the neurologist, the ENT, or again, like I said, you may need to see all those people to finally get to what's going on with you. Okay. And if you have other neurological problems as well, by this time, if you had issues with your blood pressure or anything that neurological Parkinson's and all those different things, you would have been seeing a neurologist already. So it's a whole, but again, like I said, it's like a whole health team. So you probably be your social workers, your nurse, but when you're in the primary care setting, those are the people you're going to be seeing. After you leave the hospital, they're going to refer you to all those doctors and then specialists, and you can go off from there. Okay, so that's my spiel on hypotension. I'm trying not to make these videos too long anymore because you have to say it and get right to the point. So let me just see here. By the way, for those of you who are watching, especially those who started watching me, who I met at the health fair, I really, I had a good time and I appreciate people who invited me. My sister invited me, and then this lady who's had it. So, but thank you all so much. And I noticed that I have some of my former coworkers watching me too now. So oh, I've been graded, right? Let me see the comments here. Okay. Okay. Does eating potato greens help with blood pressure? Dennis said that you know what? I don't know the nutritional value of the potato greens, but it's almost like spinach. And so it helps with it helps with the green leaf and all that. So it helps prevent anemia. So yes, that would help with help your blood pressure. Okay, so it prevents anemia, so that should help keep your blood pressure regulated. Of course, if you're eating potato greens, if you're not eating like all the heavy meat and big feet and everything else to put in there, that's gonna cause the high blood pressure. So as long as you're eating it, you know, sparingly, put it that way. So Jackie Jackson says, so can we have extra seasoning for our barbecue for the summer? You can have seasoning, yes, but watch the salt because again, you don't want to go from one end to the if as long as we're talking about hypotension now, you can have that, but they always say like don't put extra seasoning also though. Just put enough there because if you're coming to the table with your pre-existing conditions, you have to watch it. I was at a cookout on Saturday, then I went to another one on Sunday. I did a little bit on Saturday and then I did a lot less on Sunday because I wanted to make sure that I'm not taking too much salty foods because at the cookout everybody's like seasoning it way to the nth degree. So just go sparingly to enjoy, but don't overdo it. Okay. So yeah. So, but anyways, let me see if one more question with Jackie Jackson. Is it true that cinnamon helps to lower your blood pressure? I'm not too sure about that. Again, I have to look into that and I'll get back to you. I'm not too sure. Okay, it's one of those things where it's like, we had our dietitians and nutritionists and all, and they give us all the little specific details because this is stuff where we're like, okay, yes, get a nutritionist, they can tell you everything and they go more into that. But not too sure, but I will look into it and I'll get back to you on that, Jackie. Okay. Alrighty. So again, low blood pressure, hypotension, you want to be concerned if you're having dizziness continuously, if you're on blood pressure medicine and you notice any changes, if you're having heavy menstrual bleeding, if you nausea and vomiting, if you get up from your seat and you're feeling dizzy and all these things have been going on. Sometimes it's like 1 or 2 days, that's okay. But if you've seen that it's going on for longer and longer periods, you want to make sure that you bring that to your doctor's attention because again, if your blood pressure is too low, your body is not functioning well. Okay, your body needs the pressure in the arteries and your blood vessels and everything in order for it to stay up. So just remember the balloon, okay, or like a long tubing and all that. If it's got enough air in there, or if it has enough water in there in the balloon, it stays up. Well, when that doesn't happen, because what happens is your blood pressure too low, it's not going to your lungs, it's not going to your heart, it's not going to your brain, it's not going out to your kidneys. So all those vital organs get to the point where there's a risk of them becoming damaged and long-term damage too. So you don't want that. You want to protect yourself and protect each other. So I hope what I said here today has helped you guys. And like I said, I will be back on Friday to do my Friday's chat with Abby. But I wanted to add one more thing. Right now, it's like really busy. Everybody's coming in for a physical for school or for work. And also, if you have your physical examination, your form that needs to be filled out by your doctor, and you need blood work and all, please do that as soon as possible. Don't wait till the last minute because if you have any blood work done and you get your blood results and it comes back that it needs to be repeated or it needs to be something else needs to happen or you need to be referred to another doctor, that may prevent or delay you from getting into that job or to go back to school. So if your paper is due in July or August, start making appointments to see your doctor right now, especially if you need to get blood work along with it. Okay. So, as always, thank you all for watching. Thank you all for your love and support. Welcome to all my new followers. I hope this video has helped you or a family member, and you take that to your doctor and say, these are my concerns, and I just wanted to bring it to you. Okay, so thanks again for joining me. Good night to all of you. Thank you very much. And I'll see you guys on Friday, or I may just pop up every now and then. Okay, thank you for watching. Thanks for your love and support. Good night.